Hi everyone, good Tuesday morning and welcome to GoLocal Live. I'm GoLocal News Editor Kate Nagel. Thanks for tuning in with us here in downtown Providence. We'd like to welcome back, I guess we just had on Dr. Phil Chan with Brown University and the Department of Health.
Good morning.
Probably should have done the elbow bump over here, get some hand sanitizer as we talk about coronavirus. Now last time we were talking about a different aspect of your work, but as you wear many hats, you were at the Department of Health's press conference on Sunday when they announced the first case. Now we know there's a second presumptive positive case here in the state, and they're in the process of identifying a third. So let's talk a little bit from your perspective. Obviously hearing about coronavirus throughout the country, when we heard it was first here in Rhode Island, what was your reaction to, you're involved with the Department of Health and the handling of it. Let's walk us through the process of knowing about the school group, then finding out some symptoms, first of an adult and then of a teenager.
Yeah, so the Department of Health has been preparing for this now for a couple months. We've instituted what's known as an incident command structure. We've been meeting, we've been preparing, we've been working with across the healthcare sectors and with the governor's office and many other agencies to prepare. We unfortunately we did think that it was going to come here at some point, especially now that it's begun spreading through Europe especially. And in fact, those two cases, as you mentioned, had recently traveled to Italy. So we've been preparing. Understandably, a lot of people are concerned, for sure.
So let's talk a little bit about that. The group came back. The Department of Health said the adult himself did not return to work. The teenager did. Let's talk a little bit about what that almost gestation period looks like. If someone's traveled to a country that there has been reports of known cases of coronavirus. Let's talk a little bit about that self-monitoring, because I think people have a lot of concerns. This group came back over, the Department of Health was well aware, but again, it looks like a teen was at school for a few days. Let's talk about that time frame from exposure to the coronavirus to exhibiting symptoms. They initially had said that if you're not symptomatic, if you're asymptomatic, that you can't spread coronavirus, but I think some folks have concerns here.
Yeah, sure. So what we do know is that the typical point from when someone's infected to when they have symptoms is about 4 to 7 days, with an average of 5 days. So what we've been doing for people who have returned who are higher risk is to have them quarantine themselves and self-monitor for 14 days, and that's the upper level that people would develop symptoms within if there was a concern. Yeah.
And healthcare officials have said don't go to places of hospitals or public health places. They said stay home and contact your public healthcare provider. If necessary, the Department of Health can step in, assess the situation, and do testing. Let's talk a little bit about that. Is that from an exposure standpoint, if the person is perhaps ill, to again limit their contact with others out in the community?
Yeah, so a couple of points about that, certainly. If someone is sick, if you're sick with flu-like symptoms and you need to go to the hospital, an emergency room, please do, but also please call the emergency room ahead so that they can take necessary steps.
Okay.
If you are sick and need to be evaluated by a primary care doctor, please call them first. So one thing that's come up is that with this entire epidemic is that there's a shortage of personal protective equipment, so masks, etc. So some of the primary care practices don't have enough stock to adequately protect themselves and some of their patients from spread.
Let's talk a little bit about that. Again, Dr. Alexander Scott and the governor said at the press conference on Sunday, don't wear masks if you don't have COVID-19. Now, we see images from around the world, China especially, of everyday citizens wearing masks. Let's talk a little bit about that. Do we get the sense that we have enough masks for healthcare professionals here in the state?
So we are running low on supplies for sure. It is recommended, certainly the standard practice when someone who is sick, who presents to a healthcare setting, to put a face mask on them. It's also standard for COVID-19 is that the healthcare provider should wear what's known as an N95 mask. And that's a little bit more of an enhanced face mask that filters out about 95% of particles. And those are what's recommended for healthcare providers that don't have that. They shouldn't, unfortunately, be evaluating people with suspected COVID-19.
So with what's going on currently, obviously the 2 presumptive positive cases, we're again waiting a word back on that third one. With the schools closed that have been identified so far, obviously the big talk from the healthcare community, from the governor, is wash your hands, take appropriate measures. Is that enough?
Yeah, so at this time, we have not seen any community spread of COVID-19, which is fantastic. We're monitoring closely. So the steps that everyone can take are wash your hands several times a day, use hand sanitizers if you can. I mean, that in of itself has really shown that it can prevent the transmission of other respiratory viruses, including the flu. Also, certainly if you're gonna cough or sneeze into a tissue or into your elbow like this. And if you're overly concerned, and certainly if you have other pre-existing medical conditions, you may want to avoid large public gatherings.
And of course, we do hear from folks the flu and influenza, of course, year in, year out, as the numbers we see, of course, it can impact greatly. So folks, of course, are saying, well, why all the attention to coronavirus if the flu is in fact more deadly? Talk a little bit about that. Is that a factor of this being a novel coronavirus that hasn't been seen before? Healthcare professionals are still responding to it. Can you put the coronavirus sort of in that global context, if you will, for folks who are saying, come on, this isn't the flu?
Yeah, so great question. So coronaviruses do cause a significant amount of the common cold. So in any given year before this, there is significant coronavirus that we know of that causes common cold-like symptoms. The problem with this new coronavirus, COVID-19, is that it actually has a preference for lung receptors. And so what happens with that is it causes pneumonia. And so it's a virus. So there's antibiotics there's no, the typical antibiotics that we have don't work against COVID-19. And what we're seeing across the world is that in 1 to 2% of people, it has a mortality rate of 1 to 2%. And those people tend to be older, 60s, 70s, 80s, and about a quarter to a third of them have other pre-existing health conditions. If there is one bright spot in this whole thing, if you can call it that, is that younger people tend to be affected less and have less significant disease. And that's because we think that there's some differences in the ways that the receptors work in children and young kids.
So I've seen stuff on social media. Actually, last time we had you in, we talked a lot about social media. People taking pictures of their Clorox jars saying this kills coronavirus. Did those Clorox wipes not address COVID-19?
They do. So COVID-19 is one of several coronaviruses. So as I mentioned, we've known about coronaviruses, and so a lot of the typical household solutions do kill coronaviruses in general and are expected to kill COVID-19.
Anything else you want to share with viewers while we have you here in studio about COVID-19, what to expect moving forward? There's been a lot of talk on the national level, how many people this could affect nationally and globally, if we're hearing millions of people, again, with that 1% mortality rate. Do you think we're going to hit those high numbers?
Yeah, I think it's too early to tell. If you look at what's happening across the world, I think there's a number of countries struggling to get a grasp on the epidemic. Hopefully we're ahead of the curve. Hopefully we've learned some lessons. One of our mottos, of course, is always prepare for the worst, hope for the best. I think closing those 2 schools here in Rhode Island was a proactive attempt to try to limit the spread. And again, everyone across the state, it's a team effort. We're all involved. All levels of government, health department, and other collaborators are working to address this.
Do you think we'll get to that level of quarantine? Let's talk about language and semantics, if you will, because the Department of Health is using the verbiage of self-monitoring for those individuals that they've identified that had come back from that trip. But of course, that's saying, here's what we're telling you to do. Please stay home. We're going to be in constant contact with you throughout the 14 days. But again, as they try to trace back those contacts from the folks who did come from Italy, the fact that the student was at school for several days, we hear quarantine mentioned in other states around the country, usually the immediate return of people from other places where they've been most definitely exposed to coronavirus. Self-monitoring the first step, and then quarantining, is that a potential necessary step if we do see a spread here in Rhode Island?
Yeah, so I think there's 2 terms that we kind of use, throw back and forth. One is isolate. So someone's sick, then we talk about isolating them from other contact. The word quarantine is used for people that have no symptoms that we want to separate from others. And so I think what we in Rhode Island have done, as well as others across the U.S., have used self-quarantine. So people that have had exposures that are potentially at risk, they self-quarantine, and then we have Department of Health staff who check in routinely with those people. Now, the health departments do have the ability to enforce quarantine should someone not want to adhere to that. But so far we've been lucky, and we have certainly reasonable people here in the state. People have largely adhered and understand the consequences of not.
Should people alter behaviors at this point in time? Again, hearing 2 cases, the potential for a third. As you mentioned, those folks, is it really the more susceptible ones, as you said, the older individuals who might have pre-existing conditions? Are those really the ones that really need to be concerned about, again, altering behavior? Should the average, relatively healthy individual just go about their daily routine?
Yeah, so I think as we discussed some of the general sort of infection control measures, so hand washing, so I think changing behaviors like washing your hands more, using more hand sanitizer, also coughing, sneezing to your elbow, also not going out if you're sick. So if you have someone in your family member or friend who's sick, who has respiratory symptoms, not seeing them, I think is prudent. And we're recommending certainly, and this is the case in a general flu season, is that if you are sick, if you have fever, respiratory symptoms, you shouldn't be going into work or school. So I think just some common sense approaches to addressing routine infections is prudent. And I would say if you're older and have other comorbid illnesses, I mean, if you wanted to sort of avoid large public gatherings, that may also be a reasonable thought.
Well, we appreciate your taking the time to come in here, Dr. Chan, because I guess folks have a lot of questions pertaining to the novel coronavirus, and as you said, wear a couple of hats with Brown University and the Rhode Island Department of Health. So I'm going to give you the elbow bump as we let you go. And we're going to be back with more Go Local Live here this morning in downtown Providence. Thank you for joining us. To start your Tuesday, we'll be back with more news in politics and lifestyle here on Live. I'm Go Local News Editor Kate Nagelum.